and welcome. And today I'm very pleased to be talking again to Juliet, and that's Juliet Sullivan, about a book that she wrote actually a number of years ago called The Gallstone Friendly Diet. And the reason that we're talking about this is because we had so much positive feedback when I interviewed Dr. Nick about gallstones, gallbladders, and realizing how, I think the word is prevalent it is, and the issues that people have. And then lo and behold, I find that Juliet has written a story, which is, I have to say, I want to say the word bloody hilarious, but it is really funny hearing her story of something that is not funny and is excruciatingly painful about how she coped with her gallstones, having her gallbladder removed, and actually sensibly thinking how you then move forward, either before your surgery and then after your surgery. Because I think people think, I've had the surgery, it's all fine.
Mhm.
And it's not quite like that. So welcome, Juliet.
Thank you, Catriona. It's good to be here again.
So do you want to start off rather, telling us a little bit about your story and, how much pain you've been in?
Yeah, so this was in 2019, so it's quite a while ago, but I was living in England. I'm English, but I live in Canada, and I was at the time in between Canada and England. Quite a chaotic life for a few years. My dad was unwell, and I was trying to run his business. I was apart from my family, so my husband was backwards and forwards from Canada to England. My own kids, but they were in Canada. So yeah, it was all very chaotic. I'd flown a dog over from Canada and then couldn't leave England because she was there and she was elderly. And then in the midst of all that, I started getting these excruciating stomach aches, assumed I had appendicitis, even though the pain was upper quadrant, stomach quadrant, but not where traditional appendicitis is. But it was so excruciating and so unexpected and sudden that I could only think that that was what it was. I didn't put two and two together with it. Maybe followed a meal that I'd eaten until the third time it happened to me. And I realized it was soon after eating. I did go to my doctor. I had a doctor in England at the time, and I did go to my doctor, and she also didn't know what it was and kind of just sent me away and said, let's see what happens. And then it happened again. And this time I was collapsed on basically a street pavement in absolute agony. And it felt like I imagine you'd feel if you were having a heart attack, except it was lower down. But then, your mind is all over the place. I didn't know what it was. It felt very serious. I ended up at A&E. And after blood tests and a scan, I think they gave me a scan at a time, they quickly diagnosed gallstones. They saw the stones. They came in and they told me it was gallstones. I had never heard of gallstones, which sounds ridiculous now, but I didn't know anybody that had gallstones, or nobody had told me. Turns out I did know people that had it, but had never mentioned it. It's like people downplay it a little bit, or maybe they're embarrassed.
It's not
But
glamorous.
it's not glamorous at all. And when you look up the people that are prone to it, I think it's fair 40 female, something like that. There's some acronym, and it's really not flattering. And the other thing they say is if you're overweight. So obviously people don't talk about it because if anyone knows anything about it, it just makes it seem like it's your fault. You've maybe had the wrong diet, or you're overweight, or whatever. So I was then told at the hospital the only way to manage it, well, first of all, the way to treat it is to remove the gallbladder. And the way to manage it until you get the gallbladder removed is to eat a low-fat or no-fat diet, which was absolutely horrific to me. There's no guidance. There was no booklet. There was nothing. It was just,
But
this is what you do.
there was one positive, though, in that you were allowed to do, weren't you?
Yes, there was. In fact, what happened was my best friend was with me, and when the doctor came in and diagnosed what I had and then told me I couldn't eat any fat in my diet until I had the gallbladder removal, my best friend looked at the doctor and said, can she still drink wine? And the doctor said, yes, she can. There's no fat in wine. So we were elated. But, that does make me sound like I drink a lot of wine. I like wine, but, I wasn't overindulging. Her and I do like a glass of wine. Yes. So then from there, I had to wait. I can't remember. I think it was 4 months, 5 months for the operation. So I had to completely change my lifestyle and eating habits, and looked for a book that would give me some guidance. So I looked on Amazon, I looked in a couple of bookshops, and I couldn't find one single book. I could find medical books on it. I wasn't interested in that. I wanted people's experiences and I wanted some practical guidance, and I couldn't find a book. So I think it was Mia, my best friend, said to me, "You should write a book about this." And that's what I did.
I mean, I just thought I find that amazing, and we discussed earlier about how many editions your book has now done, because clearly there aren't people haven't picked up on it, and I think the way that you describe it, you make it very funny all the way through. Clearly, it's not funny subject at all, and
There's
you
nothing
were in
funny.
you were in lots of pain, but it is so practical about, okay, as soon as you know it. And I think one of the things that you were saying is that fat is actually something that you should be eating as opposed to not eating.
Absolutely. Healthy fat is essential for a healthy diet. So it's not a great way to eat, and it's certainly not a long-term solution. But when you've got gallstones and you know that the slightest, for me, it was the slightest amount of olive oil, say, which is good fat, but an avocado, they were my triggers. So, all of a sudden I had to remove them from my diet, which is not ideal. But I mean, there are ways that you can ensure that you're having a healthier diet. It's just that that is not a long-term solution. It did help me, and I would have done anything to avoid that pain because it was horrific.
And when you found out that, you had to really think about diet, did you sort of, people are quite good and they say they sort of write down, what hurts and what doesn't. Did you do any of that stuff?
Yes, I was very aware of what had caused it. And then when I started researching and I started looking at in recipes, because you don't really think about what's in certain foods. Say I did eat out quite a lot, so I wasn't thinking about what anything was made from in a restaurant. There's a lot of butter in restaurant food and oil, obviously. And then, I love, when I'm in England, I absolutely love ready-made meals from Sainsbury's and Waitrose. And you start looking at the ingredients in those, and they're not conducive to a gallstone friendly diet. So yeah, I had to start documenting everything I ate, because in case I had another attack, because I was adamant that everything I put in my body would be solely to avoid an attack. And I think in my book, I talk about even carbonated drinks. So I researched carbonated drinks, and apparently it can trigger, even though there's no fat in them, they can still, something in the carbonation is not good for you, or your gallbladder. And so for a long time, I avoided those, which doesn't sound like a big deal, but when you're denied the kind of foods that you normally eat, and I did feel like I was deprived for that time because I love food, which I mentioned quite a lot in the book. A Diet Coke was kind of a treat, and suddenly couldn't have that. I did introduce that back into my diet and it was fine. It wasn't a trigger for me. So that's kind of what I was doing. I was playing around with certain things, but I still never touched anything with fat in it for that whole time. I wouldn't even play around with anything that I thought might have fat in it. I just avoided it completely. And the other thing that's interesting is that I thought I would lose tons of weight because you cut that main thing out of your diet, and you assume you're going to lose. I did lose a bit of weight, but I didn't lose a lot of weight. I didn't, it was 4 to 6 months. I can't remember which. You'd think if you'd cut fat out of your diet completely, you would drop a couple of dress sizes or 2 stone or whatever. That didn't happen for me.
But then it shows that, as we know, that good fat is actually good for you. It's not the fat that puts the weight on.
Exactly. Yeah, that was a learning curve for me.
Yeah, definitely. So just going back to the experience of having it. So I know, you do a number of anecdotal stories, which we won't go into because we'll say to people you have to buy the book to go and read it, as to when you suddenly have the attacks at the most wrong, inopportune moment to suddenly
Oh,
collapse
wait.
and, yeah, to happen to you. And then when you get to the operation, it doesn't happen.
Well, yeah, I mean, I felt like at the time that was indicative of my chaotic lifestyle. But the first time I was booked in for an operation, I arrived at the hospital with a really bad cold and they just sent me away again. And of course, you've prepared yourself mentally. I'm not great with medical procedures at the best of times. I'm quite dramatic. And my husband had flown from Canada to England specially to look after me post-operation. And he arrived that day. And when he got there, I was at home having not had the operation because I'd got a cold. So then I had to wait, I think it was another 6 weeks before they got me in again. And then of course he wasn't there. He'd had to go back to Canada. So it just felt, for me personally, it was a hard road. The operation itself was simple. You don't know much about it, but the recovery was quite difficult for me as well.
Yeah, that was the bit that I wanted to go into. But before that, and I think I said to you that I wanted to, a doctor, I can't remember what his name was, who wrote your forward. And I know that you've got a different edition to me, so you don't have the same forward as me. It was Mr. Ian Cameron who wrote this. And I just thought this was really poignant what he said. And of course, I bet I can't find it.
You said it was page 11, was it?
No, yeah, it says 11 in Roman
In your
numerals.
book.
I was amazed that I managed to decipher that one. It's vital that all healthcare workers realise that for every patient, an operation is a major life event. And you said yourself, because we are so dismissive. You just said, "Oh, it's just a simple operation. You just go in and out." No operation is simple. I think no operation, you don't know what could happen and what side effects and all those sort of things. But it is frightening if you've not been into hospital before and there's all these different people, different smells. You meet the person that's going to open you up, 2 seconds before they kind of suddenly know all intimate things about your body. I mean, it's what a horrendous experience. And I think it's important for healthcare workers to remember
Be
that's what you're
mindful of
going
that.
through.
Yeah, because obviously it's commonplace for them. They're dealing with it all the time. But for us as patients, and especially for someone like me who is actually terrified of anything medical, I'm not scared of being in hospital, but I'm terrified of needles or things being put or things being opened up. And I was so nervous. Like, I remember, and I think I mentioned it in the book, I was shaking, like uncontrollably shaking when I went for the pre-op, I think. And I had lovely people, lovely nurses, lovely anaesthetician and amazing surgeon, but it's not the point. They're very matter of fact. One of them did say it's like a routine thing. It's nothing. And yeah, I'm sure that is intended to put you at ease. But in actual fact, it terrified me because I thought, well, and it terrified me afterwards because it didn't feel routine. It felt awful afterwards.
It's
And I don't want to
invasive.
put people off. You have to remember I am a baby when it comes to these things, but it wasn't a routine operation. I did not feel like I could get out. I couldn't get out of bed for days, but I did have bad bruising and I was on my own. No, I didn't have much support in England. I actually think that's because I told people, oh, it's fine. I'll be fine. It's routine. I'll be fine. I'll be up and about. I was planning to go back to work very soon afterwards. So it was quite kind of shocking. And I do think people should be prepared for that. And I think the medical professionals should maybe not play it down the way it was played down for me.
I think there's ways and means, isn't it, of playing something down. So, I mean, actually moving on to the recipes, it is divided between before and after, isn't it, really? Before your operation.
Yeah, well, yeah. I mean, I talk about what you should eat when you have gallstones, or what I personally could eat. I basically cut fat out completely, but then I did find ways to replace the fat. Say if I was doing a stir fry, I sometimes would use wine instead of oil, and it works. You can fry vegetables in wine quite nicely, cooks off the alcohol, just water sometimes. I mean, it's not as tasty if you use water, but it still works. There's ways of eating without fat. And then after the operation, I was gradually reintroducing fat into my diet. And I think I say in the book, I plan never to eat heavy fat content meals again, like fish and chips. And I have stuck to that. I haven't eaten fish and chips since that day. But that's because I suddenly became aware of how fatty that meal is. We grow up on it. I grew up on it. I lived in Brighton. It's a fish and chip town. So, I grew up eating fish and chips every week thinking that was okay. But when you look at the fat content, it's not great. And so I have never touched that since. It's just something in my head, I think. It's just, it's just it wouldn't feel good for me. But I have reintroduced almost everything else back into my diet. I have gone back to eating red meat. Yeah, butter, uh, olive oil. I would only ever use olive oil or avocado oil, but and healthy fats, because it is healthier to have fat in your diet. So yeah, I talk about what worked for me pre-operation, and then how to gradually introduce it back into your diet post-operation.
And I just thought the recipes were, it's great because you cover every meal and snacks and drinks. I was going to say you're not a cook, and I don't mean that rudely, but I mean you're not
No,
renowned for being a cookery writer. But it's just written like, yeah, I could do that. Yeah, I
good.
can do that. It's not pretend. I don't want to say
No,
pretentious, but it's
no.
and you put tips in there, which are like, yeah, they're top tips, the things that actually we need to know those things.
Well, good, because I wanted to write recipes that obviously would relate to people, and for people that aren't chefs and aren't great in the kitchen. I'm not naturally gifted in the kitchen. So I had to relearn the way I cooked. And I've written that for people that I feel are similar to me, people that may not have that natural ability to come up with recipes in the kitchen. And the top tips were, okay, this is what I found worked for me. So it's all based on everything in there is based on what I discovered worked for me and then how I adapted it. Some of those are just adaptations from recipes that I knew, but I then worked out how I could eat them or cook them without fat.
Yeah. Well, Juliet, thank you so much for coming along again to chat to us. But as I said, I'd really highly recommend this if you're going through it or you know somebody who is, because it actually really, really helps, and going forward after the operation. So, Juliet, thank you so much.
Thank you, Catriona.